We move now to the consolidated 2014-15 year-end financial report, and I would like to invite Paul to introduce the paper.
Thank you very much, Malcolm. The report stands as you have it in front of you. I'm pleased to say that the accounts for NHS England and for all 211 CCGs were delivered on time, in full, to the auditors a few weeks back, and that, so far at least, one never cries the end of the process until it's actually there, but so far the audit is progressing well. Perhaps more importantly than all of that process stuff, though, the numbers you've got in front of you confirm a final outcome for the year which is in line with the forecast that we discussed the last time we met based on month 10, in terms of both the bottom line spend and the efficiency, which of course we measure through the QIP savings that we reported in the programme. And when confirmed by the auditors, and clearly not before, they will also demonstrate that we have met, as Simon said earlier on, all of the financial objectives set for us in the mandate and in the operating plans that we signed off this time last year. You'll see that there is an underspend of 282 million recorded in the accounts. Just by way of context, always important with numbers which relate to such a big organisation or set of organisations, that's 0.3% of the resources that we have. And to an extent, it is a response to a request that was made of us to defer spend which was discretionary to ensure that in the overall financial position of the health sector, we made as positive a contribution as was possible. The good thing about that is that the 282 will be carried forward to be invested in future years, and more particularly 179 million of it. You might ask why that particular number. It was based on a kind of control total we agreed with the Department of Health, will be available to us in addition to the funding that we had previously talked about. For example, when we talked about allocations last year, will be available to us next year to cover off both some of that expenditure that was deferred and to deal with some of the other challenges that we've got. The mandate will in due course be reopened, the mandate that we discussed back in December, to record both that 179 million, the 150 million that we added for the tariff additions that we put in place back in February, and one or two other items, in particular the mental health expenditure that was announced fairly recently. So all of that will come through in a formal way to our mandate for 15-16, but it's an important part of being able to present the next item that we'll come to, which does record a balanced plan for 15-16, which would not have been possible without the additional funding that came from our performance in 14-15. So I guess I'd want at the end of that particular introduction just to place on record my thanks to the excellent teams in CCGs, in CSUs, and indeed our own NHS England teams, not just because they have managed to get the accounts in on time and they look as if they're heading for a successful conclusion to that process, but equally in a very challenging year to the way in which they've managed the ups and downs of the situation as they found it, to deliver a set of numbers which is as close to the plan as it is, and on the positive side at that. I'll spare you the individual detail, all of which is set out in the usual appendices, but I guess I need to provide a bit of a bridge from the paper that we're looking at now on 14-15 through to the paper that we're about to talk about on 15-16, which paints an altogether more challenging picture of financial positions. And I think in that context, I just want to point out a few caveats about the numbers for 14-15 that you're looking at. The first thing to remind ourselves is that they benefited from 400 million of prior year surpluses being available in 14-15 to supplement the recurrent resources that are made available. That's a really important part of understanding it. It's an important difference between the way that our finances work and, for example, the finances of the provider sectors work, which is a year-by-year basis. The second thing is, and I've pulled out most of these things in the report here, it benefited from a number of very specific factors, which I think we need to regard as being unlikely to recur, at the very least in the quantum that they did in 14-15. We've talked before about the relatively slow rate of spending against the legacy provisions for continuing healthcare. That ended up the year being 156 million less expenditure than we had assumed, and that is directly reflected in the 282, and more particularly in the CCG number, which is, as it happens, more or less the same number, being 151 positive. The second big one you can see on the sheet there is the underspend on NHS England's running and central programme costs, that was in large measure an anticipation of the savings that we are required to make for 15-16, which therefore we can show as savings in 14-15. Clearly our budgets for 15-16 are significantly lower than they were in 14-15, and therefore our ability to underspend in that way next year will be somewhat curtailed. So those two big factors, alongside a number of smaller factors which make the interpretation of the 282 in particular one to enjoy with a bit of caution. I would say the financial grip has been tighter this year than it was in our start-up year. So, for example, the variances in specialised commissioning, which you can see in the tables here, are significantly smaller than they were in 13-14. But it is still the case that specialised commissioning is struggling to contain cost growth within the envelope that we are able to make available to it, even before you consider factors like the Cancer Drugs Fund, which again grew significantly in 14-15, was a very significant cost pressure. We've taken some actions recently to start to address that, but even so, managing that particular area of expenditure, not to leave out some other new drug pressures, which we'll come to when we talk about 15-16, all of that is a fairly live struggle, as it were, month in, month out, which you can see if you go beneath the surface of the numbers that I've just presented. On the CCG side, similarly, if you strip away that continuing healthcare benefit that I talked about, if you strip away the fact that CCGs earned less quality premium than we anticipated at the beginning of the year that they would, there is a slight overspend, if you like, in the CCG sector in total, despite the efforts that CCGs have been making across the months to contain their expenditure. And of course there were 19 CCGs, which I think is stated in the report, who ended up the year with a cumulative deficit position, with all of whom, of course, recovery plans have been discussed and are now in place. So, all in all, a position where we met our financial targets, but where the signs of the challenges that we face going forward were absolutely visible to anyone looking just a little bit under the surface of the reported numbers. And all of that, of course, needs to be seen. That's the commissioning system I've just described. Simon set out in his earlier piece the context of the provider side, which in 14-15, of course, had an extremely tough year for all the reasons that Simon set out. One of the things Simon didn't mention in talking about the provider positions was the relative sectoral balance, if I can call it that way, within the provider sector, which I think we just need to have in mind as we think forward to the challenges. It is the case that almost all of the challenge in the provider sector was in the acute sector. That much, I guess, we knew and would have expected. It is also the case, though, there is a big difference between the specialised hospitals and the teaching hospitals, and indeed the larger hospitals, whose margins last year were relatively positive, 5.7% for specialised hospitals, 4.8% for teaching hospitals. If I contrast that with the small and medium hospital sector, the small acute hospitals, 0.4% of EBITDA margin. I think that gives a good sense of not just the overall quantum of issue that we've got across the health sector, but the fact that it is quite concentrated in its severity on the smaller and medium end of the sector rather than the bigger end, which makes some of the things that we have been doing of late, it makes the measures that we put into the pricing, the enhanced pricing package we put in, where, for example, the marginal rate for emergency care was increased, it makes those important small ways in which we can start to address what appears to be both an imbalanced position within the sector and some significant issues in the acute sector. So I hope you'd agree that that is something which, as we go into 15-16, we'll have to have a mind to as well. I don't want to dwell too much on 14-15 because it's much more interesting to talk about 15-16, even for an accountant who hasn't yet got his account sign off. But if there are any other points on 14-15 before we move forward, I'll be happy to deal with them.
Well, thanks very much for the report and for that context. Could I invite the chair of the audit committee to comment?
Yeah, thank you. I think I sort of support everything you say, Paul. I mean, for the avoidance of doubt, I mean, we live in a system of government accounting, public expenditure, treasury control, where we have to come within control totals imposed on us as an arm's length body and contribute and help Department for Health come within their control totals. And you said that we did that in a system with many moving parts. That does require a robust financial oversight, which as a maturing organisation we are providing. It requires a focus on emerging issues early, and I think we've demonstrated that in the second year, although there's a way to go. It requires us to have resilience on surprises, and those surprises can come from external events, but they can also come from identification of poor management, poor governance and other things in the system. And we also need to be resilient against new asks which happen in year. And I think 14-15 is characterised by, we're sort of in a headwind all the time, and it's challenging, but we know that's the world we're in. We had a few gusts behind us, this year, which mean that the underlying run rate is actually worse than the numbers that you've presented. And I think that is just really important to understand as we look into 15-16, because the headwinds will still be there, and I certainly wouldn't want anybody to think that the gusts are in the bag, because they don't. It doesn't happen that way. So I think really great management and oversight from us from a non-executive position, I think, showed that you were on top of it and increasingly on top of it, but there's quite a challenge ahead, and I think it's really important that we move to 15-16 with that, with 14-15 having been done, but done with some helpful one-offs.
Thank you, Ed. Are there any other comments on this paper? No. Well, I please take that as written. Please, Paul, again, congratulations and many thanks for you and your team and taking us through the headwinds, because we know that as we turn to 15-16, they're going to get even stronger.